No Country Radio, WYFO, 105.5 FM in Jessup. Apparently a squirrel must have got fried out there and called a power surge to come into the studio and cause the transmitter to go off. It has a safety thing on it where if it gets a power surge, it cuts off for a minute and then comes back up. You're listening to WIFO FM in Jessup. Big Dog Country Radio, WIFO. World famous Butch and Bob Show, brought to you by Nips Car Wash, located on Highway 301 South here in Jessup, and also brought to you by Murphy Builder Supply. We got a morning pack this morning here on the world famous Butch and Bob Show. First of all, will be State Senator Blake Tillery, and then after that will be Congressman Buddy Carter, and then right in the middle of his interview, we'll have John King, the Georgia Insurance Safety Fire Commissioner, call in. Then we'll get back with our interview with Congressman Buddy Carter. Bob, go ahead and with the interview with Senator Blake Tillery.
We got Blake Tillery on the phone. Tuesdays with Tillery. Blake, how you doing today? Blake, you there? Hello?
Go ahead.
Blake, you there? I can't hear him.
Blake, you with us? Okay, go ahead.
I can't hear what he's saying.
He's not saying anything.
I can't hear him.
He's not talking. Blake? Okay, Blake, you with us? You can just barely hear us? All right. Tell us what's going on. You there?
I can't hear you.
Do we need to pop something up? Yeah, he's on. He's there. He's there. As usual.
No, you don't have the phone button pushed. Lower button.
Okay, there you are. Okay, go ahead. All right.
Oh, sorry.
Okay, go ahead.
I'll start back over.
Okay, start back over. Here we are.
I know. First, thanks again for allowing me to be on this morning. As you know already, your listeners know the General Assembly has paused session. We met last Monday. Can you guys hear me?
Yes, go ahead.
Okay. I met, hearing a lot of feedback. Loud
Sure, go
sound.
ahead.
Well, the General Assembly met on Monday and gave the governor emergency powers due to the public health care state of emergency. As you know, he immediately moved and closed schools. It's hard to believe that was only a week ago now. It feels like much longer, everything that's happened. Here locally, though, a lot of business going on, much the same from a Senate perspective. I'm on day 6 of my quarantine. As you may have heard, we had a little issue at the Senate, so the legislature itself is under a 14-day quarantine. But I was able to have phone conferences yesterday with 10 of our 11 counties, leaders in each one of those, making sure they have the supplies they need. They're doing such a great job, really staying on top of the situation for our communities. I'm so grateful to them, and really that's where the rubber hits the road to begin with. Still dealing with local issues as well. We had a grocer who had an EBT issue yesterday, a city that had a GDOT issue the day before. So while it's very different, work is still getting done.
But again, the question everybody wants to ask is that any idea when the session is going to reconvene?
No idea on that. And when we do reconvene, as you know, we're going to have a big budget issue. I know Congressman Carter's there. He's dealt with this before. He came through a really tough time with the General Assembly. We're going to have to deal with that when it happens. That the budget will probably be, it will definitely be the biggest issue we take up when we get back, and it may be the only one.
Other question I got for you. Governor Brian Kemp ordered some series of measures to try to curb the spread of this coronavirus, but he's getting pressured to do more and more. Some cities are closing down altogether. Your thoughts on, is he doing enough?
Yeah, well, the governor's order yesterday closed bars and clubs. It also said if you have a business that has more than 10 people that gather there, then they have to be 6 feet apart or you have to close. And that's for everybody. That's for nonprofits. It's for government entities. It's for businesses. It's for stores where we shop, et cetera. Also ordered sheltering in place for those who have been exposed to COVID or have COVID or have a underlying health condition like a lung issue, et cetera. There are a couple things I'd like to say about that. One is, I've heard a lot of comments back. I think the governor's taking steps that are appropriate in the situation. I know that some folks wanted him to close everything down. Well, remember, essential services will be the only things remaining, and everyone thinks their service is essential. I'll tell you, the folks who are looking for toilet paper right now think Rayonier is essential. I'm not sure that would have been on the list. I can tell you that they didn't think they would be on the list based on the letters they sent us asking to be qualified as essential. Another thing that closing down the state completely would do, it would really, I think our capitalist system is set up to reward ingenuity. And we've seen that happen. We've seen folks move to curbside that we never thought could. We've seen in our local community, Ralph and Jamie Hickox, what they've done out there at the drive-in to keep people employed. I know that's what a lot of folks are thinking about right now. It's what my office is thinking about. No, I'm not an essential service. I'm an attorney. And we've taken steps at our office to keep folks employed while at the same time making sure that we don't have a full staff. People need to be safe and be home with their families and be 6 feet apart. So I appreciate what the governor's done. The other thing I'd say is this. If, I don't get the Monday morning quarterback. I wasn't brave enough to run for governor. So what Ashley Nicole and I are doing every day is praying that he have wisdom. I know the folks in your listening area are doing that as well.
What are you hearing from what are you hearing from the health officials? What are they telling you? What's the forecast for the next week, the next month? What do you hear?
I think you're going to continue to see numbers jump as we'd have already. You know that this is, as testing rolls out, we will see at least our case numbers jump. But let's talk about those for a second. I think it's important to put those in perspective. As you know, right now the U.S. has roughly 46,000 cases, roughly 582 deaths. The state of Georgia has, as of 7 p.m. last night, 800 cases and 26 deaths. And the counties that touch us that have cases, we're blessed right now. In Wayne County, we don't have any. 3 counties that touch us do: Glenn, Pierce, and Tatnall. If you want to go out another tier, the counties that don't touch us but are one away, Liberty, Ware, Coffee. So that's 6 counties in the roughly 1 hour driving distance, I would say. You have to add Chatham to that as well. But as we talked about those numbers, while those aren't to be minimized, and I don't want to do that at all, remember that the 2017, 2018 cases of influenza killed 34,000. That's 93 a day. And it's seasonal, so it's probably more like 200 a day. Suicides in our country, we have 48,000 deaths a day. That's 132 a day. Heart disease, 840,000. That's 2,300 a day. I don't say those again to try to belittle COVID, but I do want to make sure that we keep it in perspective as we're talking about this disease. Do we still need to fight it? Do we need to take the steps that public health officials are telling us? Absolutely. But at the same time, if we succumb to hysteria, it doesn't help us fight the problem.
Okay, Blake, we appreciate you calling in. How many more days do you have to be quarantined?
I'm on day 6, so I've got 8 more. I've been watching, though, Congressman Carter, what he's been doing in the communities out there, helping provide relief. I mean, he really represents the best in what folks are doing. I've seen other businesses do this as well, where they're getting out there, helping others, and just so thankful. It really is incredibly encouraging, especially at this time.
Have any advice for these people that are staying home, how to kill time?
I don't know about killing time. Right now I'm writing up memos for almost all the employers we represent of how they can keep their people employed and trying to summarize these federal acts. But that and praying for our leaders for wisdom would be where I would ask our community to spend much of its time.
Okay. Again, we appreciate you calling in, and we'll talk to you again next Tuesday.
Thank you, guys. Have a good morning.
All right, thank you. Senator Blake Tillery right here on the world-famous Butch and Bob Show, WIFO 105.5 FM in Jessup. And, Bob, we've got Congressman Buddy Carter in the studio with us.
Yeah, we're grateful to have the Congressman in the studio with us. And, Buddy, how you doing?
I'm doing wonderful. I'm feeling great.
I've seen you around different areas helping with hand out food, things like that. I think you were in Richmond Hill the other day. I saw you in Savannah over the weekend, so you're getting out and about.
We are. We're getting out and about. I think it's extremely important for people in our position to make sure that we encourage everyone, and it's important for all of us. I think times like this bring out the best in Americans, and truthfully, we really do need to make sure that we're checking on each other, to make sure that we're keeping each other encouraged. I can only imagine. I haven't had to self-quarantine. I can only imagine being cooped up for 14 days like that. But at the same time, making sure that we're checking on people, making sure we're checking on our senior citizens, our neighbors, making sure, do they need anything, any errands run, any groceries, anything that we can do to help them. All that's extremely important.
And the question everybody keeps asking is, why isn't there enough tests? It seems like we're ill prepared. And the other question people ask is, how come LeBron James and the LA Lakers can get tests, but the regular Joe Blow can't get a test? What's that about?
Well, that's a good question, and I've been very frustrated that we here in the 1st Congressional District haven't gotten as many tests as some of the other areas of the state, and I've let it be known with the Public Health Department about that. A couple of things. First of all, the platform that we used, and when I say platform, I mean in the sense of the way, the structure that we had set up here in America was not set up to handle such a big volume, and we've learned from that. And I think that we've got it corrected as quickly as we could. It was a system that worked well in the past, but it's not set up for this type of volume. So we had to get that straightened out. We have gotten it straightened out. We're going to be getting the test, and there are tests out there now. But here's the thing, and Dr. Birx has made it clear, Dr. Fauci has made it clear that, you don't necessarily need to take the test. If you don't feel well, yes, you need to go to your doctor. You need to see if you need to be tested. But we all need to practice good hygiene. We need to wash our hands. We need to cough into our arms. We need to cough into tissue and throw the tissue away. We need to make sure that we are being careful. It doesn't necessarily have to have a diagnosis that you have it in order to be careful. And that's what we all need to be doing at this time.
Again, 10,000 new cases across the United States yesterday. They said the numbers are going to continue to go up. They said we're not even close to the worst of this. What are you hearing from Dr. Fauci and people like that? Like I said, the health officials are the ones that know more about it than anybody. What are they telling us?
Well, we've known from the get-go that this is a very contagious virus, and that it is spread rapidly and very easily. So it is something we were expecting. We knew this was going to happen, and we knew that as more tests got out there that we would have more cases. That makes perfect sense. Let's face it, 80 to 85% of the people who get this virus are asymptomatic. They don't show any symptoms. And it is really those whose immune system has been compromised, who have a compromised immune system, such as senior citizens and those who have been through chemotherapy and other types of medical problems in the recent past that are most susceptible and most vulnerable. So those are the ones that we have to be careful about. I was reading an article last night about the nursing home in Washington State where they lost almost a third of the population. I actually, as you will remember, I was a nursing home consultant for many years and worked in nursing homes and actually witnessed something very similar to this with the common flu. We had a nursing home, and I won't mention any names, but we did have a nursing home that lost, almost a third of their population because they did not get the flu vaccine in on time. So, it is very serious, particularly to those who are vulnerable, particularly those who have a compromised immune system.
Around this area, most people are heeding the advice, but when you see the news and you see all the spring breakers down there on the beach and they finally closed it, but a lot of people just aren't getting the message. So
and
where's the frustration in that?
That's very frustrating and very unfortunate because even though they may not be susceptible and vulnerable, they still can get the disease and get the virus, and it can have long-term effects on them.
As you know, we got a jam-packed show.
Sure.
I think we got our other guest calling in, so John King, so we'll talk with him.
Okay.
Well, good. We would appreciate you calling in this morning. We're going to have you on the air right now. My news and sports director, Bob Morgan, is going to be interviewing. And just to let you know that we've got Congressman Carter in the studio with us. He's doing an interview. He's taking a quick break so you can be on the air, okay? He says hello. Right, go ahead, Bob.
Okay, we got the Insurance and Safety Fire Commissioner John King on the phone. Mr. King, appreciate you being here on the world-famous Butch and Bob Show. How you doing today?
I'm doing well, sir. Thank you very much for having me.
Well, we appreciate you calling in. Again, you want to talk about what your office is doing to assist Georgians during this virus outbreak. So the floor is yours, and tell us what you need us to know.
Well, thank you. I was named by the governor to lead a small group of not only government but industry associations in a way to look at the strategic plan of how do we remove obstacles in regulations that get in the way of this response. We work very closely with the Trucking Association, the Retailers Association, to make sure our supply chain has continued supplies into our stores, to make sure that Georgians continue to have the products they need to sustain our life and our way of life in our state. So we've done a lot of great work in a very quick period of time. The governor announced a series of announcements removing a great deal of these regulations that got in the way, and that's one of the reasons why I think we're in better shape than others, because we got on these removing these obstructions early in the game. We're working very closely with the Georgia Emergency Management Agency, ran by Director Homer Bryson, who's working at the immediate, what I call the tactical needs and the operational needs of our state. While we in our small group of preparedness committee, we're looking at the longer-term policy obstacles and looking at how do we, get through this crisis, and then how do we, bounce back and get our state back on its feet.
As you're just joining us or just tuning in, John King, Insurance and Safety Fire Commissioner, with us here on the world-famous Butch and Bob Show. As you mentioned, the governor imposed a series of measures yesterday. Do you think those will be helpful? Do you think people will heed that advice? I was just talking to Congressman Buddy Carter. You watch the news, and some people are taking the advice and doing what they're told to do, and others are simply just ignoring the facts. So how do you deal with that?
It's one of those where the communities, we can't expect the government to be looking at over our shoulder. It's going to be neighbors and friends, and as you know, I come from I was a police chief in Doraville, so I know that the local communities truly have, will guide a great deal of this response, and will get us. I would say the majority of the people will pay attention, will heed the warnings, and will listen. Then there will be a small group of folks that only us as a community can really, call them to account for what they're doing, because they're not helping their effort. And people don't realize the magnitude of the challenge ahead of us. And it's going to take all of us, neighbors, friends, local leaders, legislators, congressmen like the one you have there in your studio. This is how we're going to get. It's going to take all of us.
We've been trying to emphasize to our listeners, where to get the correct information. The Department of Public Health continues to update it twice a day. What would your advice be if people have questions, want to know the information? Where do you say is the best way to get the best information?
I'll tell you, for people who are savvy on computers and the web, the Department of Public Health, CDC, has, and GEMA, the Georgia Emergency Management Agency, has the updated and accurate information. Locally, every district in Georgia has a public health official as part of the Department of Public Health. They're a great local resource with the county health officials. Those are instead of picking up your news off the internet, you need to look at these resources who are paid and are incredibly professional and know their business.
Commissioner King, Butch Everett here. What other ways does your office help folks during this crisis, and how can they turn to you, and what else are you doing in your office to help folks through this crisis?
Well, we reach early in this crisis. A lot of the insurance companies were asking us, "Hey, what can we do to help?" Other states approach this by issuing edicts and demanding that the industry. Folks here in Georgia, they need that. They volunteer to come forward and help us with a response. So as a result of that, we put out rulemaking under our rulemaking authority. We put out guidance that if somebody loses their job, or out of no fault of their own, that as a result of this crisis lose their job and they can't pay their insurance, they will not lose their health coverage. They will not lose their property insurance. And this is because the industry is working with us. They realize that we're going into a very critical and a very unusual crisis, and so they're coming on board and helping us out. We've issued a number of guidance as well to health insurance carriers. They're working with our medical professionals to allow them to do telemedicine, where instead of going to a doctor's office, you can call your doctor on your phone and describe what you do, and they'll conduct a consult over the phone. And the doctor and the medical staff will be reimbursed at the same rate they would have been had they gone into the office. And this is a way for us to try to help shape the demand signal going into our hospitals, and also how to prioritize folks that need the test. We want folks to go and see their doctor, not just show up at one of these locations and want to have a test because they think they might have it. We need them to see their doctor. That way, we're focusing these tests as we increasing the number of tests dramatically every day. We want to make sure that we use the tests for the right people, and only a medical professional can really help do that screening.
Well, Commissioner King, we do appreciate you taking time out of your busy schedule this morning to call in here to the world-famous Butch and Bob Show. We do get press releases from you, from your office, and we do appreciate that. And feel free to call in anytime and set that up to inform our listeners about what your office is doing there with the Insurance Safety Fire Commission office, okay?
Thank you very much. I appreciate it.
Take care. All right, WIFO 105.5 FM in Jessa, Big Dog Country Radio, world-famous Butch and Bob Show. Bob, let's get back to our interview with Congressman Betty Carter.
I'll tell you, it's a jam-packed show today.
That's awesome.
State Senator, Congressman, and the State Insurance Commissioner. So
I tell you, the Insurance Commissioner is doing a great job. I think the state's doing a great job. The leadership that Governor Kemp has shown and all those around him, I've been very impressed with that.
I just can't imagine the pressure the governor's under. I mean, it's, like I said, there's going to be time to armchair quarterback down the road, but to take pot shots at the guy under this kind of, like I said, we've never seen this in our lifetime.
No, we haven't.
Everybody's trying to do the right things. They're trying to do the best they can do and juggle, what do you do as far as safety goes, but, as I said, can't shut everybody down. And some people just aren't going to heed the advice at all. So
that's exactly right. And there's no playbook for this. We've never experienced any of this. None of us have ever experienced it before in our lifetime. And I will tell you, we're going to read about this. Our children and our grandchildren will read about this in the history books. So what has happened here is unprecedented.
The question people keep asking too, what's going to be the long-term economic impact? I mean, like I said, just look at the sports world. Just look at that. I told the story, I listened to AM 1370 Fox Sports, the NCAA tournament by itself. All those bets that were made in Vegas had to be refunded. They said that NCAA tournament in Las Vegas is 11% of their income for the entire year.
Right.
Just gone.
Right.
Because the tournament wasn't held. I mean, that's just NCAA basketball. NBA's been shut down. NHL's been shut down. No, NCAA football is in jeopardy. The Olympics are gone. I mean, that's just the sports world. That's just one whatever of all the economic. You got all these businesses. I saw yesterday where the Georgia Ports Authority said they're not shutting down, that they've got to stay open. So there's some businesses they just can't shut down.
And especially small businesses. And that's, small businesses are the backbone of our economy here. 99% of the businesses out there are small businesses. But, especially if we look closer to home, St. Patrick's Day Parade. Right. I mean, for some vendors, that's where they make their money for the year. And that's gone. That's wiped out.
And the thing that people really get frustrated, all this is going on, and you watch TV. I'm not sure if they reached an agreement. They may have reached an agreement by now, but the last 2 days, the Democrats and Republicans continue to bicker back and forth. I mean, you just want to throw something at the TV.
Yeah.
You're like, are you kidding me? All these people are suffering, and you're up there arguing. What is that all about?
Well, and it is very disappointing. First of all, it's a little bit confusing what's going on now because we've had 3 phases thus far, and we'll probably have 1 or maybe even 2 more phases of this. The first phase, of course, that we had with the coronavirus relief package had to do with making sure we got more tests out there, had to do with making sure that we were getting funding to the CDC and the NIH to develop a vaccination. Then we passed the second phase. The second phase was more employee oriented and targeted toward making sure people got sick leave, making sure that the unemployment was there, and also some loans for small businesses. Now we're in the third phase, and the Senate is taking the lead on that, which all appropriation bills are supposed to start in the House. So why the Senate is doing it is beyond me, but nevertheless, the Senate is taking the lead on that, and they've run into problems. They can't get past cloture. They've had 2 votes, which means that they can't start debating the bill until they get past cloture. And it's unfortunate because, as you point out, and rightfully so, the American people are impacted here. I mean, these are real people who have real businesses who are suffering. And we see it every day. I'm trying to be in the district as much as I can to keep people encouraged and to make sure everybody's okay. But I will tell you, people are really suffering out there, and it's really sad to see. But at the same time, then you look at Washington and I'm not pointing fingers, but at the same time, one of the things that they teach or that you should understand is to stay in your lane, and that is focus on what you're working on. Unfortunately, the Democrats are trying to bring in things into this package that have no place in here. And we've got to start focusing on people, on families, and on workers and businesses.
Some things that have been implemented that are going to help people. Like I said, they delayed the income tax filing all the way to July, so that's helped. The insurance commissioner just talked about how people won't be punished if they, so there's some things are helping people, but watch that craziness in Washington it's just very frustrating.
It is.
Hopefully, I said they say they're close. Hopefully they'll get something done, but those people need relief.
Well, they do, and explain to me where Speaker Pelosi comes out with a bill and the Democrats in the Senate are trying to interject things into this third phase of the relief package having to do with, they want more Obama phones. They want to bail out the post office. They want to require the airlines to spend money on carbon offsets and trying to decrease the greenhouse gases from the emissions on airplanes. What has that got to do with what's going on right now? It has no place. That's why you need to stay in your own lane. Let's concentrate on what we're doing. Let's get that relief as soon as possible to the people, to the workers, to the families, and to the small businesses.
Currently, the presidential primary and the local primary is set for May 19th. Right now, that's still the date. Do you see that being delayed at all, or are you hoping that is the date?
Well, of course, today was to be the presidential preference primary, and that was delayed and put in with the May 19th. I'm not sure that that's going to stand. I've heard that they're going to delay it to June 17th. If that happens, then that's just what we'll have to deal with. I hope that they go forward with it personally, but then again, if it's, like I say, until June 17th, that's fine.
The president yesterday indicated he doesn't think this is going to last as long as the medical professionals, and I'm sure he's getting criticized for all that. So who are you listening to? You listen to the medical professionals? I mean, or are you just going to wait and see what the numbers do in the next couple of weeks, or where do you stand on that?
I thought it was interesting, the president's comments, especially when he said, that he was beginning to wonder if the cure wasn't more expensive than the problem here. And obviously, we've got to take care of our people, and that's what the president is focused on and has been focused on, the health and safety of Americans. He's always been focused on that. But at the same time, look at what this has done to our economy. I believe it's a week from tomorrow that the 15 days will be up, and a decision will have to be made then. Have we flattened that curve? We were expecting that spike. Have we been able to flatten it to the point now that our hospitals can and will be able to handle patients if they start coming in? Listen, these numbers are still spiking, and they're going to spike. We understand that. There is talk now of making sure and just limiting those who are most vulnerable to this and most susceptible to this, making sure that they're quarantined and that they're taken care of, and then letting everybody else go back to work. That to me is an alternative we certainly should look at.
I go to that website, Georgia Department of Public Health, every time at 12 noon and said, look at the numbers. It's amazed me so far with everything going across the United States that Chatham County is because there are 4 cases. Glenn County is because it is 4 cases, still none in Wayne at this time. They say it's a matter of when, not if. So, but do those numbers surprise you with what's going on across the United States? Why do you think we're so fortunate at this point?
Well, one of the reasons why we're so fortunate at this point is that we don't have very many tests. and I think if we had more tests, we'd find that we have more cases. Now, that doesn't, the thing about the test, again, is that we understand what we're supposed to do. If we will do what we're told to do, what we're being instructed to do, and practicing good technique as far as hand washing, wiping down things, making sure that we're doing all the things that we can do, then we can fight this invisible enemy. And we will be able to do that. But at the same time, as these tests goes up and they get more prevalent and we have more people, then it's going to be a spike. And remember, 80 to 85% of the people who are impacted by this are asymptomatic. They don't show any symptoms. But they can still have long-term effects from that, particularly young people. We've seen in Europe where some of the young people who have been impacted are having scarring of the lungs that will last for a lifetime for them. So they have to be very careful and take this very seriously. It really does concern me when I see particularly young people on the beaches who are not taking this seriously.
How about Rand Paul? Did that shock you that he went into the pool after he knew he was being tested? I mean, what's your thoughts on that? I mean, he's supposed to be a leader, and he's not leading by example at all. And now he possibly infected some other people.
And he's a doctor as well, so I might mention. But
did that shock you?
It didn't shock me. Nothing shocks me in Washington D.C. anymore. But
oh, gee, you're already at that point, now, buddy.
I was at that point about mid-afternoon my first day. But we do need to set a good example, and that's unfortunate that happened. But look, if we just use common sense, and there are a lot of people who are hollering over that we've overreacted. That's debatable. Again, I think it's a case where the administration, where this president cares about the health and safety of our country. And yeah, there are some things that we have learned through this process and that we will do better next time, I'm sure. One of the things that I'm working on, if I could just take just a second to mention this, is the fact that 90% of our antibiotics and pain pills and ibuprofen and hydrocortisone and some other things and vitamins come from China. And we need to address that. We learned in the early 70s, or I should say the late 70s, that we were dependent on oil from the Middle East, and they were holding us hostage for that. We knew at that time, in order to have for our national security, we had to have energy independence. Now we have learned that we need to have pharmaceutical independence. We need to repatriate those companies, those manufacturers back from China, and get them back to the United States. And we're working on legislation right now in our office, working with Senator Marco Rubio on some legislation to do just that.
Again, buddy, it's always good to see you. Like I said, we appreciate you taking time to be here on the world-famous Butch and Bob Show to give our listeners this information. So, again, just want to stress again, as you mentioned, be smart. Again, the biggest thing they tell people, if you don't feel well, stay home.
That's right.
That's where it really starts. I mean, if you wake up and you don't feel well, don't go to work. Stay home.
Absolutely, common sense. I mean,
you feel like you got a fever, stay home.
That's right. That's right.
And any other final words this morning, Congressman Carter?
Just again, let's be smart about this, as you just pointed out. Let's all use common sense and let's check on each other. Let's be there for each other. If you know someone who is suffering, let's face it. These are tough times. These are tough times for a lot of people. I mean, people are hurting, and let's just make sure that we're encouraging each other and being there for each other.
And support your local businesses.
Absolutely.
Before you go, just one final. The one group of people that I feel for are seniors all across this country. No junior senior prom, apparently no graduate. You got any message for those people? Those are the ones my heart breaks for. I mean, you don't get those back.
You're exactly right, and I hope that they'll postpone them and not just counsel them, but in a lot of cases, I'm afraid they're counseling them, and that's just so sad.
Away with their commencements. Georgia's done away with theirs.
That's right. And what about those spring athletes?
Right.
You know, they lose a year of eligibility.
The colleges are giving the year eligibility back, but high school senior doesn't get that.
That's right.
They got to move on. So
that's right.
It's affected a lot of people in a lot of ways that, like I said, we've never seen before. It's kind of sad, but.
And that's why we need to be there for each other, encourage each other.
And, I look at, the decisions the president and the governors have to make, like Governor Brian Kemp. You've got to balance that between keeping businesses open, supporting the economy, and then also looking out after the health issues. And that is a balancing act, because if you go way far one direction, you're going to have a problem. If you go way far the other direction, you're going to have another problem. The economy could just tank, and then you got to solve that. Then if you don't address the health issues, then you could go out of control. So that's a balancing act. My hat's off to the president and to all the governors out there who have to do this balancing act of trying to keep the economy going, plus but also taking a look at the public health issues. I'm glad I'm not making those decisions.
They are tough, and we need to keep them in our thoughts and prayers, because they are under enormous pressure, and it's very important that we support them. And we may not agree with every decision, and certainly we don't, but at the same time, they deserve our prayers.
Right, and we don't have all the information they do, so it's hard for us to judge, I think.
And the other thing we continue to stress is, all these small businesses, restaurants are staying, their windows are open. So we're encouraging people to please support those businesses, because they need that income. So that's why I keep stressing. I try to do that once a day, go to a different restaurant, go to the drive-thru and support these. Appreciate them staying open.
I appreciate them staying open. My wife is stranded in New Orleans with the grandbaby right now, and I'm batching it, so
my stove's
I need it.
I tell people all the time, my stove's not plugged in, so I appreciate that. I need those drive-through windows open. So.
Congressman Buddy Carter, our special guest here on the world-famous Butch and Bob Show. We wish you the best and good health, Congressman, and we look forward to having you back on either in the studio or by phone to keep the folks in the district area updated on this situation.
Thank y'all.
All right, take care. All right, the world-famous Butch and Bob Show brought to you by Nips Car Wash, located on Highway 301 South, just past McDonald's. They're on the left-hand side. And also brought to you by Murphy Builder Supply on Northeast Broad Street in downtown Jessup. The time now is 8:38, 105.5 FM in Jessup, Big Dog Country, WIFO. Up next, your official weather forecast.
World famous Butch and Bob Show.